This is a new installment of Wall Street Votes. So, Alex, what about health care? That's one thing that a lot of people are concerned about.
Yeah, there's lots of ways to wind up looking for something like this, but there's four that really stood out to me that it seems like Wall Street's going to be caring about. One, of course, is the Medicare for all. That's like cradle to the grave coverage that picked up a lot more conversation during the pandemic. The next one we know is definitely going to be drug prices. There's many different ways the administration can go about this. The one everyone's going to be paying attention to is if the government can directly negotiate drug prices. The next is going to be any expansion for ACA Medicaid. Again, lots of different pieces that the administration can do to expand that kind of coverage. It's good for some and then not for others in terms of companies. And then the other kind of elephant in the room is that a public option plan left out of ACA would be an enormous shift within the healthcare market and would definitely potentially make more competition for those private insurers as they'd be forced to lower costs, as people would have the option whether or not they wanted to do employee health care or go with the government plan.
At the same time, a lot of talk about prescription drugs. A lot of people want to limit the price of prescription drugs. None of us want to pay too much for drugs. Is that likely to get done?
Well, I should refer people to BI. I hate to do self-promotion, but Bloomberg Intelligence has a great screen that takes a look at all the different sectors and what the laws are or the potential laws against or for them, if it's positive or negative, and the probability of it being approved. There's a couple things that they can actually do. If you look at something like negotiate the drug prices directly, maybe 60–70%. That's what the BI screen was saying. Something else, though, is the Medicare mandatory rebates. Now, that requires drug companies who increase prices faster than inflation to return that back to Medicare. That would hurt guys like Regeneron or Roche or Amgen, J&J. Those are the names that are exposed. The other is dealing with the Medicare Part D drugs. That's the same sort of situation. That would also hurt the PBMs. That could happen, negotiating sort of directly with the pharma, taking out PBMs in the middle.
So you're so good at markets, let me put you on the spot. Is any of this being priced in, do you think, at this point, or they just don't know what to price in?
No, it doesn't really feel like it because markets last year looked at healthcare particularly as more of a safety trade. So that's what happened with the healthcare situation last year. Now you've had individual moves like Pfizer, for example, on the vaccine trade. Also, in the list of priorities, where is healthcare really going to be, right? We've heard everyone talking about COVID and then the stimulus. Well, not even stimulus, COVID recovery, then stimulus, right? So where is healthcare on that ladder is pretty much farther down. So not necessarily being priced in. If we're going to talk about this later on in the program, too. If you're going to look at something that's not priced in, though, that's more taxes, that could be come up a lot faster, and that's going to have a bigger implication for all the different sectors as well.